As soon as someone has a terminal diagnosis with the life expectancy of 6 months or less, they are qualified for hospice and they should be going on hospice at that time. We want people to get on as early as possible. There are so many things that we can do to help them, to help the family, and the earlier that they get on services, the better. So how do you know when they're within 6 months of their life? Their provider should be able to identify that. However, sometimes they aren't. But you, the family member, can see changes that are happening on a regular basis. And a lot of times when somebody has a disease and they go to the provider, they're suddenly like looking better, feeling better, and the provider is only getting like a little piece of what's really going on with them. So it's important that you are communicating to that provider the things that you have seen: changes in eating habits, or symptoms related to their disease, weight loss, which sometimes is evident just because their clothes don't seem to be fitting them as good anymore, less energy. Something that's really important to pay attention to is when people are telling you, I'm tired of this, I don't want to do this anymore, I'm done, I think it's the end, I think I'm going to die soon, and you can self-refer. You do not have to wait for a provider to refer you to hospice. You can call hospice anytime if your family member or you have a terminal illness or a serious illness that seems to be getting worse and it ultimately is terminal, such as COPD or congestive heart failure or dementia, and you're seeing these changes. You can call hospice, you can self-refer. They will do all of the legwork to figure out if you qualify and help you to get on services. Better too early than too late, because if you outlive that 6 months prognosis, you can still stay on service as long as you continue to meet that eligibility requirement of a life expectancy of 6 months or less.